खा लिया है, खाने के बाद मैं किसी को ज़्यादा खा लिया है, इसका गिल्ट होता है। ऐसा नहीं है। तो I will read list of one patient what she consumed during binge between 4:30 to 6 p.m. And that was 5 pastries, 3 barbecued chicken, 3 quarter of Italian bread, regular size of jar of peanut butter, a half liter of milk, a box of chocolate, a liter of diet coke, 2 cake. And that was thrown up by the end of that period. And a similar binge was repeated at 10 p.m. I don't think this is the typical, but what I would like you to understand that people with diagnosis of any eating disorder, they really have some behavioral disturbance and it is serious. It is not like कि just हमने कुछ खाया इसके बाद हमें बहुत guilt हुई and after that we have done something very funny. No, this is not eating disorder. Clinical characteristic. As I already said, a bunch of people with anorexia nervosa end up moving into bulimia nervosa. When they gain weight, their weight becomes normal, but they keep binging and vomiting. It's mostly women, weight normal, onset little bit older than anorexia nervosa. If typically anorexia nervosa is a high school illness, this is typically a college illness with a lot of variation. And most people, सुनो आप लोगों ने कार्बोहाइड्रेट क्रेविंग, तो मोस्ट पीपल जो होते हैं वो स्वीट चीजें खाते हैं. मोस्टली जो मैमल्स मतलब ह्यूमन बीइंग्स को पसंद हो, जैसे आइसक्रीम होगा, स्वीट्स होंगे, मिठाइयाँ होंगी, कॉफी होगा, केक होगा. एंड उसके बाद कंपनसेटरी बिहेवियर करते हैं. कंपनसेटरी बिहेवियर मोस्टली इन 90% केसेस इट इज वॉमिटिंग एंड इन 33% लैक्टेटिव साइकोसिस. These are the physical complications, silent symptoms like irregular menses, dent erosion, alas salivary gland, laxative dependence, ischemic toxicity, gastric rupture, laboratory abnormalities like hypokalemia, hypokalemia, hyponatremia, alkalosis, acidosis, hyperamylesemia. Most people who do this regularly for 5 to 10 years, they have no physical complication. This is impressively tolerated as long as weight is maintained. So this is alas salivary gland. Filling and top front, probably related to bulimia. Top T is shorter than the bottom, and it turns out that any type of acid softens dental enamel. Eventually, it will get soft and it will start to chip away. And some people with bulimia further by inducing vomiting and wash particularly their front two teeth with stomach acid over and over again. That they start to lose. That's what happens here. It is permanent complication, rare, but it obviously happens. This is calluses. This illustrates that how prominent this behavior can become. This is the back of hand of somebody with bulimia, and here is callus on the back of hand. She got these by inducing vomiting by tickling the back of her throat with her fingers. Every time she did that, the back of her hand would bump against her front teeth. So she got callus on the back of hand. You get idea from this that how recurrent and obsessive behavior can become. Prevalence of eating disorder among women, anorexia nervosa 0.5%, bulimia nervosa 1.2%. So why? Theory of development of eating disorder. Predisposing factors: females, genes, environment, societal emphasis on thinness. Precipitating factor: stresses of adolescence like precipitating factors, dieting, then they binge eat, then again they do dieting. One of the reasons is the emphasis on being thin and being fit, and the push on people to diet increases the chance that people are going to get into trouble. So we can't deny role of culture in this. So I have collected all these pictures since 1965 in Miss India, and you can find before 1984 they were more curvy, and since 2010 they have become thinner and thinner and thinner. So how are we working to better understand and treat eating disorders? Researchers are unsure of the underlying causes and nature of eating disorders. Unlike a neurological disorder, which generally can be pinpointed to a specific level on the brain, an eating disorder likely involves abnormal activity distributed across brain system. With increased recognition that mental disorders are brain disorders, more researchers are using tools from both modern neuroscience and modern psychology to better understand eating disorders. One approach involves the study of the human genes. Neuroimaging already is used to identify abnormal brain activity in patients with schizophrenia, obsessive compulsive disorder, and depression. It can also help researchers better understand how people with eating disorders process information, regardless of whether they have recovered or not. Researchers also are working to define the basic process of the disorders, should help identify better treatments. So, binge eating disorders. Key diagnostic features are incorrect binge eating, no compensated behavior, marked distress about the behavior. Compared with patients with anorexia nervosa and bulimia nervosa, those with binge eating disorders are older, more frequent, most are overweight or face low levels of mood and anxiety disturbances are there. So treatment clearly varies the disorder, thereby lending support to the validity of the diagnostic system. And this is the list of all the treatments like thyroid hormone, ACTH, lobotomy, ECT, promethazine, insulin, amitriptyline, lithium, phenoxybenzamine, domperidone, PSC, cyproheptadine, fluoxetine, psychoanalysis, individual therapy, family therapy, behavior therapy. This means two things. First, illness can be very difficult to treat. People will throw at it anything that's in their tool bag in trying to help people get it better. The only way you know something is going to work in general if you got to do control trials, and for control trials you got to apply scientific methods to know whether any of this stuff works. You need data, good data, and it is very difficult to compare. Treatment of anorexia nervosa. Weight gain is essential. 4,000 kilocalorie above maintainable per pound gain. Intensive and structural nursing care usually successful. Parenteral method, psychotherapy, which is flexible, supportive, education, family treatment. No evidence for specific treatment. Bulimia nervosa, psychotherapy and medications like antidepressants. Treatment of binge eating disorder, a range of treatments appear in reduction of binge eating frequency and improving the symptoms of distress. Several forms of psychological treatments, weight loss, occasional intervention, effective progression in general, orlistat, topiramate. A significant problem in evaluating this data is that high rate of symptomatic improvement in response to non-specific intervention. That is high placebo response. How are men and boys are affected? Although eating disorders primarily affect women and girls, boys and men are also vulnerable. Binge eating disorder affects females and males about equally. Like females who have eating disorders, males with the illness have a vast sense of body image and often have muscle dysmorphia, a type of disorder that is characterized by an extreme concern in becoming more muscular. Some boys with the disorder want to lose weight, while others want to gain weight or bulk up. Boys who think they are too small are at a greater risk for using steroids or other dangerous drugs to increase muscle mass. Boys with eating disorder exhibit the same type of emotional, physical, and behavioral signs and symptoms as girls. So, anorexia nervosa disorder recognized for centuries, but still poorly understood and sometimes difficult to treat. Bulimia nervosa more recently recognized, but useful treatment rapidly developed binge eating disorder. They are not really sure that this is a real disorder. Thank you very much.
Thank you, Dr. Suchi, for a very informative session on common eating disorder and its causes. And for me, one thing, why it is so that high cholesterol is seen in the cases of anorexia nervosa. Showing one of the slides that in patients of anorexia nervosa, high cholesterol.
Actually, this was one thing because even I was not able to understand why this is mentioned here. But at every case it was mentioned that there was high cholesterol. Some symptoms with the एक ही चीज आती थी कि why there is increase in cholesterol in these patients. And so they are doing some work on this. जैसा भी होता है.